When talking about clinical trials in general, I like to reassure families that I would never offer them something that I don't think is the right thing for their child. And so going through kind of the different types of trials that we offer to families in an upfront setting where we're really thinking about a large phase 3 trial, sometimes with randomization, sometimes with not. Without randomization, I think it's super important to go through that and try and understand that. Randomization is a challenging topic to discuss with families. You want to make sure that they understand that I can't determine it, they can't decide which treatment regimen they're going to be on, but rest assured that through the really constant monitoring and the close monitoring that if ever we realize that there is one part of the trial that's a little bit better than the other, then we make sure that their child gets that very, very best treatment. So as we're looking at the data that is published and is out there and kind of helping families to make decisions based on that data, I spend a lot of time talking to them about exactly how the study was run. And so looking at things like how many patients were enrolled, were all the patients treated in the same way, were all the patients required to meet certain eligibility criteria, were the patients treated across multiple institutions where not only one physician was deciding who to enroll, but multiple physicians all around the country were deciding who to enroll and who qualified for enrollment and not. We know that the very, very best trials and the best data comes out of multiple institutions where large numbers of pediatric cancer patients are enrolled in trials. They all look relatively similar, so that any small little differences in each individual patient is taken away. Those differences are taken away by the large numbers that are enrolled in the trial. When we look at data and I help families go through clinical trials and the data that comes out of it, there are a lot of different terms that we have to go through and discuss. And the most common thing that we look at in pediatric cancer trials is something that we call event-free survival. The most common thing that we look at in pediatric cancer trials is something that we call event-free survival. Those time periods differ, so some studies talk about 2-year event-free survival, some studies talk about 5-year event-free survival, but essentially what that means is in that time period, has the child suffered relapse or death? And so that is really the goal and kind of one of the main things that most of our trials actually look at. A lot of trials then also report overall survival, and that means during that time period, again, whatever that time period is, be it 2 years, be it 3 years, be it 5 years, that the patient is still alive at the end of that time point, and really doesn't give you an understanding of whatever has happened during that time. So to me, the most important data that I like to look at when you're analyzing clinical trials is really event-free survival, because that tells you how successful that therapy is for that period of time. Really, at the end of the day, I feel like that is my job, and that's the job of my team, is to help the family take all of this well-meaning information and figure out what happens to be the very best for their child as they go through.